Everyone is afraid of cancer, and the morbidity, mortality, and recurrence rates of cancer are extremely high. However, some cancers are detected early and treated early, and the prognosis is good and the survival time will be prolonged. Therefore, everyone must understand the early physical characteristics of the cancer. What signs indicate that cancer is coming? 1. There are nodules in the body. When there is a nodule in a part of the body, you need to be vigilant. It is generally divided into benign and malignant. It should be judged by looking at the size, texture and boundary activity of the nodule. If it is a malignant nodule, the growth rate is relatively fast, the texture of the lymph nodes is tough, the border is not clear, it will adhere or fuse with the surrounding tissues and have poor mobility. 2. Persistent pain. Almost everyone has experienced pain. People will go to the pharmacy to buy pain medicine, but this will mask the condition and delay the best treatment time. To rule out the possibility of trauma, seek immediate medical attention if the body has persistent pain of unknown cause. 3. Cough has not been cured. Colds, bronchitis, or pneumonia can cause coughing, and many people ignore it or use cough medicine directly. However, persistent cough does not cure or blood in the sputum, especially those who smoke for a long time should be alert to lung cancer. 4. Fever for no reason. Generally, a cold or pathogenic bacteria can cause fever. However, unexplained fever persists and it is necessary to be alert to the coming of cancer and go to the hospital for a comprehensive examination in time. 5. Fatigue and weight loss. I haven't deliberately dieted or exercised to lose weight recently, but my weight has dropped for no reason, my body is getting thinner and weaker, and I am prone to fatigue and anorexia. It may be that cancer is coming. 6. Sudden abnormalities in male breasts. Although the risk of men suffering from breast cancer is extremely low, if breast hyperplasia or other abnormal changes are large, you should be alert to male breast cancer. 7. Ulcer wounds have not healed. Wounds or ulcers on the skin continue to not heal, requiring early skin cancer. Especially oral ulcers recur repeatedly, and they still do not heal for more than 1 year, so you need to be alert for oral cancer. 8. Spontaneous fracture occurred. There is no obvious external force or fracture caused by coughing or sneezing. It is most likely a pathological fracture. In this case, pay attention to bone malignant tumors. Especially for adolescents, the possibility of trauma is excluded, and joint pain and swelling should be alert to leukemia. 9. Black moles suddenly become larger and the color changes. The color of the black mole is suddenly black or brown, the color becomes larger, the local ulceration bleeding or the edge becomes irregular, there is obvious pain and itching, the original hair on the black mole is shed, and you need to be alert for melanoma. 10. Changes in bowel habits. Changes in bowel habits, stool frequency and traits, blood, mucus or pus in the stool, constipation or diarrhea alternately, need to be alert for colorectal cancer. 11. The voice is hoarse and difficult to recover. The voice is persistently hoarse and lasts longer. It may be lung cancer or larynx cancer, because as the cancer cells grow, the recurrent laryngeal nerve will be compressed, causing hoarseness. 12. There is a sense of obstruction when swallowing food. There is obvious bloating or burning sensation behind the sternum when eating, and there is a foreign body in the esophagus, especially when the swallowing food obstruction becomes worse. You should be alert for laryngeal cancer and esophageal cancer. 13. Persistent digestive abnormalities. Occasional indigestion and loss of appetite occur once or twice, don't worry too much. If it persists and is accompanied by acid reflux and heartburn and discomfort in the upper abdomen, you should be alert to stomach cancer and esophageal cancer.